Welcome back. It's a joy to know that you're still tuned in and here on Doxa TV, bring you conversations on health this Wednesday, like the promise is. Now, since the beginning of October, we've been drumming it up that it is Breast Cancer Awareness Month. And of course, over different newspapers, we have had hospitals calling us to go for free screening, free consultation, and things alike. Now, today we have a doctor in studio to discuss more about breast cancer. It should be noted that this is a disease, one of the most common cancers in Uganda lately, especially taking on lives. And interestingly enough, even when it is one of the ones that can easily be treated, it's one where people get to catch it later. We are streaming on YouTube, so you can catch us there on this conversation. But this morning, I have Dr. Paul Bakowa. Do I have that right? Yes, from ADDY Memorial Hospital, who is going to be taking us on this journey. Good morning to you, Dr. Paul.
Good morning.
How are you doing?
I'm all right.
I am all right as well. You can probably say good morning to the person who is watching you before you get into the conversation.
Good morning to all our viewers. My name is Paul Bakowa, as earlier stated. I'm a general practitioner working at ADDY Memorial Hospital in Kanyanya, and I'm here to talk to you and the viewers of Doxa TV about breast cancer and breast cancer awareness.
All right, and that is where we want to start from. Of all cancers in the world, of all things in the world, why did we need an awareness month for breast cancer?
So, speaking about breast cancer, breast cancer is one of the most commonly diagnosed cancers, both in the developed world and the developing world.
Okay.
So, in the developed world and the developing world, it's the most common form of cancer in women, and in the developing world, it's the leading cause of cancer-related death amongst women in the developing world, whereas in the developed world, it's only second to lung cancer.
Okay.
And then, if you also come to still in its epidemiology, we do find breast cancer in men, although it's very rare. Women are about 100 times more at a higher risk of getting it than men. And another reason why it's a very important public health disease is it's something that you can screen for. It can be caught early, treated early, and then also prevented. So it's, regardless of its mortality and the morbidity it can cause, if caught early, you can reduce on these endpoints that it's going to give.
To give. Okay. Now, you quote about, you mentioned if it's caught early. Where do we catch it from? At which corner?
At which corner? So, breast cancer, we have what we call screening modalities. But before we start on screening, there are things we want ladies to be on the lookout for.
Okay. And ladies, we are talking as young as 5 years or a certain age. Which stage or which age should be concerned about it? So,
interesting enough, it's breast cancer can affect women from puberty all the way to the elderly ladies.
So that is about 12, right?
Yes, about 12 up to beyond 70. However, the most high-risk population are ladies above 40.
Okay.
So it has what we call a bimodal distribution, where it peaks in the 5th decade, it comes down, and then it peaks again as you clock 70. So there are what we call the symptoms that we tend to advise ladies to be on the lookout for.
Yes.
So of the symptoms, things to look out for, first and foremost, the breast size. So every lady has different breast sizes, but they are plus or minus the same size on both sides. So if one is becoming bigger than the other, that is something to be on the lookout for.
Yeah.
There's change in color. So if you're getting, let me call it a rash, like scaling. It looks like a scale on one side of the breast. Any lumps, so a swelling that is growing progressively within six months and above. That is something to be on the lookout for.
So hold on. So when you start to, is that when you feel it, when you hold it and you feel the swelling? So you have to keep watch of it for 6 months, or as soon as you see it, you're like,
No, when you see a lump, you are supposed to come in for screening.
okay,
When you see, okay, there is seeing and then there is feeling.
okay,
So I wanted to start with the things you see, then you can feel.
okay,
So, then also the nipples. If you get what we call an inverted nipple, so your nipple is normally protruding.
yes.
So if it inverts, it falls inwards. That is
That's a
something-
possibility.
It is a possibility.
Okay,
So what we call the inverted nipple. So if normally it's protruding and then it inverts, that is something to be on the lookout for.
okay,
Then also if you're having a discharge from the nipple, most times we say a bloody discharge. If you're having a bloody discharge, those are danger signs, those are things to be on the lookout for.
okay,
Then, when you come to feeling, of which there is a technique that we may go through, that we shall go through, when you come to feeling of the breast, there is, so when you're feeling the breast and you feel any lump, so we have lumps that are, we have what we call benign and malignant diseases. Benign is, you find a swelling that is not cancerous.
okay,
Then malignant is now the breast cancer that we're talking about. It has the ability to spread to other areas.
yes,
So when you feel and you feel a lump, you feel a mass, there are now things we would want you to feel for. So there's what we call consistency. What does it feel like? Is it hard? Is it soft? Is it firm? So hard, normally what we tell people is when you touch your forehead, that is hard.
okay.
When you touch the tip of your nose, that is firm.
Wait, okay,
Then when you touch your upper lip, that is soft.
all right.
So hard, that is a malignant lesion. Most breast cancer tumors are hard. So that consistency. And then feel the margin. Is it regular or is it irregular? So there are swellings. So like for pregnant or for breastfeeding mothers, then there are times when you feel the lumps in the breast. There are times when the breasts have lumps.
What is the margin? You've left me there. Feel the margin. What do you
So,
mean by that?
So when you feel a lump in your breast, the sides you're trying to feel for, is it smooth,
Okay.
or is it having edges? Like one, it's the down, then it's irregular. The surrounding of the lump
Yes.
is irregular. Those are signs that, you know what, this might not be something that is, this is something that might be dangerous.
Okay. Now, the other thing I wanted to ask you when it comes to feeling, it was so interesting to me because the first time I ever heard about examining yourself as a girl, I thought you just go straight at it. But then we were told to go through the armpits. Tell us a little bit about that.
So, the technique for the self-breast examination happens in 2 stages. So the first stage is inspection. So what are you supposed to do? You're supposed to undress fully,
Okay.
stand in front of a mirror, then look at, because that's the best way you're going to get an objective view. Stand in front of the mirror, look at both breasts, size, as I said, size, contour.
Yes.
Then after examining the breast from the mirror and you do not see any obvious abnormalities, then you can go lie on your bed.
Okay.
There are 2 ways. You can either stand or you can lie on the bed. So when you lie on your bed, you're going to, so if you want to examine the right breast, you are going to get your right arm, put it over your head. Put a small pillow at the back of the right shoulder.
Okay.
Then throw your arm over your head. Then using the palps, these 3 fingers.
Okay.
So the breast, we divide it into quadrants. So outer, inner, outer, inner.
Yes.
So when you lie on your back, we expect that the breast tissue is going to distribute evenly under gravity.
Yeah.
So you start feeling for every quadrant. In every quadrant, you feel with the palp of these 3 fingers. So you feel in a circular motion. You finish that quadrant, you go to the next quadrant, then the next, and the next. If you decide to go clockwise, go clockwise. If you decide anti-clockwise, you go
That is also
anti-clockwise. Now, to finish, you also feel in the armpits. So why we advise for feeling in the armpits? They are what we call lymphatic tissue in the brain, in the breast, sorry.
Okay.
And they are what we call lymph nodes in the armpit, what we call the axilla. Now, breast cancer, or the cells of breast cancer, they metastasize, or they move through what? They move in different ways.
Yeah.
But one of the ways they move is through the lymph drainage.
Okay.
Now, when they drain from the breast, 75% is going to drain into the what? Into the axilla. So when it drains into the axilla, it's going to go into a lymph node.
Okay.
Now, when it goes into a lymph node, you're going to have multiplication of the cells in the lymph nodes. So the lymph nodes are going to swell.
Right.
So we advise also feel
In the armpit.
the armpit, the different points of the armpit on the side, in front, behind, outwards, and also the top.
Okay.
Yes, because it can. That is one of the routes of spread.
Now, yesterday, you and I were having a conversation, and you said something that left me in awe, and we were talking about the causes. And in most cases, when we hear conversations on cancer, it will always be lifestyle, the lifestyle lately, what we are eating. Yet, yesterday in our conversation, you said, interestingly, the causes of cancer are not obvious. They have not yet really been determined. Tell us a little bit about that.
Okay, so whenever people think of disease, let me give an easy disease. Okay, not easy. A common disease like malaria.
Yes.
So we know what causes malaria.
Yes.
Plasmodium.
Mosquitoes.
So for cancer, it's quite different. So cancer happens at the most basic level, at the genetic level, at the DNA.
Okay.
So they are what we call a protective and they are what we call protective measures. There are ways cells are going to prevent a cell from moving from a normal cell into a cancerous cell. So when you have a breakdown in that mechanism, the cells are going to progress towards becoming cancerous. Now, what causes that change is not very obvious.
Okay.
However, we have things we call risk factors. A risk factor means it's going to increase your probability of getting that disease.
Okay.
So, for breast cancer specifically, there are a variety of risk factors. So people tend to divide them. You have your medical history, your reproductive history, and then your lifestyle.
Okay.
So in reproductive history, we start with age of menarche. So at what time did you start your menses? So research has found that ladies who started their menses early, so before age of 12, are at a higher risk. Not saying they're going to get, but they're at a higher risk.
Right.
Ladies who get menopause later, so above 50, are also at a higher risk. The average age of menopause in Uganda is interestingly 51.7 years.
Okay.
Then also what we call nulliparity, so not having children, also increases your risk. Then late start of pregnancy. So ladies who have their first pregnancy after 35 years of age also increases the risk. Another thing in the reproductive history is, so when you reach menopause, what is going to happen is your level, for ladies, the level of estrogen and progesterone are going to drop, estrogen specifically. So for some, when they're having the symptoms of menopause, they are started on what we call hormone replacement therapy. Now, use of hormone replacement therapy also increases the risk. Now, then you come to
The lifestyle one.
Lifestyle history. So, in the West, their prevalence of breast cancer is higher than
in
us
Africa.
in the developing world. This has been attributed to diet.
Okay.
Our diet is low in carbohydrates, low sugar, low in fat. Compared to theirs is highly refined.
Yes.
However, with change of diet in Africa, we are also seeing a
The
rise.
increasing, yeah.
Then, you also have diabetes. We are having a sedentary lifestyle and obesity, and also diseases like diabetes mellitus, or diabetes.
Yeah.
Also increases the risk. So, as I told you, men are at a lower risk than women for getting breast cancer. Also, as you increase in age, your risk for getting breast cancer increases. Then, family history. So if you have what we call a first-degree relative, so either your mother, your sister, or your daughter has history of either ovarian cancer or breast cancer, you're going to be at a higher risk than the general population on having what? In having breast cancer. Because there are 3 genes that are typically affected. There's the breast cancer gene 1 and 2. They are the ones that are commonly implicated in what? In the genetic way that you're going to have the distribution
that you may be
breast cancer
affected. Oh wow. I officially apologize to my biology teacher for missing out some of these lessons, because now Dr. Paul is doing his work for him. I'm doing some catching up to do here. But we have to go for a very short break. The conversation is still going. We need to know, where do we go for help? Now that all has been stated, now that we know, now that we've self-examined, where do we go next? That is the conversation we'll be having after the break. Welcome back. The conversations keep on going even when we are in the break. This is a very sensitive topic because it feels like men with cancer is something that just came in the recent years. Growing up, we never used to hear a lot about that. But we are still talking about cancer, breast cancer at that, as we are coming to the end of the Breast Cancer Awareness Month. We are still here with Dr. Paul Bakowa from ADDY Memorial Hospital. And now I wanted to ask you, Doctor, what are the current screening guidelines and what is the importance of early detection?
So, we have what we call, there are 3 lines, let me put them, 3 lines of diagnosis.
Okay.
So we have the clinical examination,
Okay.
we have the imaging, and then most importantly, we have the biopsy. So the examination, clinical examination, is you come to see the doctor, he or she does the examination, the breast exam, examines the axilla, then we go home.
Okay.
Then we have the imaging modalities, of which there are 3 still. The first one is the mammogram. The mammogram is an X-ray. They examine the breast, low-dose X-ray. We look for any changes in the breast tissue itself. Why it is very important is it can even detect very small lesions that you are not able to feel, whether self-exam or even a clinical exam by the medical practitioner.
Right.
So it's our first line actually, the mammogram for screening. It's the first line. Then there is the breast ultrasound, and then there is the MRI. MRI is high level, so we think
Yes,
maybe
that
there's
is the
high
last.
level for high risk patients, very high risk patients, or a patient that you have diagnosed and you want to see about the spread. And then the last one is, okay, now we have caught the tumor. Now we want to see what kind of, is it cancerous, is it not? If it is, what is the genetic subtype, or what type of cancer is it, because it's going to determine the treatment.
Yeah.
So the frequency of screening, the guidelines that we follow, the American Cancer Society guidelines, they recommend, so for ladies in their 20s and their 30s, okay, all ages,
Okay.
a monthly self-exam on the same day. So if you say I'm going to examine myself on the 28th, it should be the 28th
Okay.
of every month.
Of every month, right.
Regardless. So for the clinical exam, they recommend every 3 years.
Okay.
Now, for the screening mammogram, so for ladies between 40 to 50, they recommend you first start yearly, annually.
Okay.
Then between 50 to 75, you go every after 2 years. So if you go in 2025, go in 2027, 2029.
Yes.
And then beyond 75, now it's going to depend on what your medical practitioner determines.
Yes.
If your 10-year survival rate is, if your survival rate for the next 10 years is still very high, then come
They
back
could
every
even-
manual. But if it is lower than 10 years,
Yeah.
at times they say, you know what, it is okay. Let her just continue with that
The self-examination.
examination.
Ah,
Yes.
okay. And then how about the early detection? When is early detection? You are telling me about the stages. Okay.
So screening, the entire point of why screening came into play and why we want it to be done that frequently is if we can find, or if we can grab the tumor at the earliest possible stage. Because I think there's nothing here, stage 1, stage 2, stage 3, stage 4.
Yes.
So even when you go under those different stages, there is a way we classify them according to the tumor size, according to the lymph node involvement, and if there is a metastasis. So the most important, the most critical stage is if we find the tumor at the earliest possible stage. So let me say you have T1, T2, a tumor between less than 20 millimeters or less than 50 millimeters. If we can find it at that early stage, before it involves the muscles under the breast, before it goes to the other breast, before it goes to the lymph nodes, before it goes to the bone, before it goes to the brain.
It can get to the brain.
Yes, the breast cancer metastasizes to bone, to liver, to lung, to brain.
Whoa. Okay.
So it's very devastating at stage 4. That is when
Yes.
you're having metastasis. So if you can find it early, you grab it early, you can go for, so it's, breast cancer is under what we call solid tumors, solid cancers, so you can literally feel for it.
Yes.
So if you can get the earliest possible stage, you go to, they are what we call the oncological surgeons mainly for cancers. He cuts it out, then you start either on chemotherapy or radiotherapy. It can be treated at that point.
Okay.
Then they will tell you, hey, you come back this often for checks, so that we see that everything is okay.
Yeah.
So if you grab it at that stage, well and good, it can be treated. Now, the further it progresses, the harder it becomes to treat. So if you get it at a very early stage, it can be treated. It can also be prevented in the Western world for ladies who are at high risk. So you have history of a tumor in the other breast, your mother had breast cancer, you still have breast cancer. There are modalities they give. They try to treat them. There's also what they call, you can actually, for ladies who are at a high risk, you can actually go for mastectomy. So they take out your breasts, both of them, even without evidence of a tumor.
So just because you know we have history of it, I'm at a very high risk, you
So
go and you deal with
They
it.
take away the proposed problem.
Do you know what it would mean for a woman to live without the two best friends?
Yes, it comes with
It's what you
It's
said.
problem,
The risk,
the risk
what you cause
versus-
to lose versus what
Yes.
you get. I understand that. So there's something interesting you said, that it does not really necessitate the stage it is at. It is the damage that has been done. So is it possible that you could come in and you're at stage 2, but maybe the lymph nodes, the what have been affected, or the bone, it could be little, but it's at the bone level, and that could be where it is at a dire stage. Or as long as it affects any other, the bone, the muscle, the what, then that's when it elevates to the next stage.
So, when you go to staging, there are 3 things: tumor, nodes, metastasis. The moment there is a metastasis, that's at stage 4. It has already left its primary area. It has gone
Now
to a
it has
distant
spread.
area.
Yes.
That is different. That is now stage 4. That is the end, like the end point of tumor staging. Now, how we say stage 2, stage 3, stage 1 now depends on a combination of the other 2, of the tumor and nodal involvement.
Yes.
So even them, we have T1, T2, T3. Even nodes, we have N1, N2, N3. So now it depends on the combination of those 2. You might be having what we call T2 and NO, so no nodal involvement. They'll put you in stage 1. Then so that staging is about how widespread is the disease. So a local tumor or a disease that is still in the primary area can be removed, can be treated. A disease that is a bit more extensive requires more extensive treatment.
Okay. Now, we have to come to the end of this discussion, and a few things that I wanted us to probably hint on. Cancer has always really positioned itself as one of the most expensive diseases to treat here in Uganda, but also in the movies that we watch on what's happening abroad. Are there affordable ways to treat this here in Uganda? And also, what advancements have been made in the fight against breast cancer right now in Uganda?
Okay. So, the most affordable way to treat breast cancer is to prevent it.
Okay.
Catch it as soon as possible, go for the screening, do the self-examinations, go and do a mammogram, go for a breast ultrasound scan if necessitated.
Yeah.
That is the most, I would say, affordable way to in the battle against what? Breast cancer. Prevent it. Prevention is better than cure.
Okay.
Now, for the higher, so it has occurred, it has been called, let me say, stage 2, stage 3. Then there, we go to UCI. Uganda Cancer Institute, I think, is one of the most developed cancer institutes in actually East Africa.
Okay.
So, the modalities, the new modalities that are there, first in diagnosis is the MRI. That is available in many of the institutions around Kampala.
Big hospitals, yes.
Yes. So an MRI plays a role. There's what they call a PET scan. Mulago has, but it is not really well developed in our setting.
Okay.
It's mainly for if there are metastasis, it will tell us where the met is, how widespread the disease is.
Okay.
Now, for treatment, the modalities, because we do know that breast cancer is more or less hormonally related, so the treatment is also in that line. So when you go and they do that, what we call biopsy, where they take off a sample, a piece of flesh, a kanyama.
Yes.
And they take it for studies. They do genetic studies. So they look at which genes are being expressed by this cancer. So this breast cancer, is it expressing the estrogen gene? Is it expressing the progesterone gene? Is it not expressing any of them? Is it expressing the HER2 gene? There are those different genes that are going to be looked out for, which are being done in Uganda at UCI. So when they know the subtype that is being expressed, or the subtype of breast cancer that you're having, then it's going to determine the mode of treatment.
Yes.
So there are the hormone treatments, then there are the antimetabolites. Those are the ones that have been around for a long time. There are different modalities of treatment. So it's not going to be attacked in one way.
Yes.
It's going to be a combination. So they're going to combine this hormonal therapy with this antimetabolite therapy. There is also what they call the platinum-based therapies. So the combination is first and foremost going to depend on where have we reached with our staging, what kind of tumor we have.
Okay.
So now they can combine that chemotherapy with surgical intervention if needed, and also radiation therapy. So it's going to come down to what is the oncologist thinking, what have they determined is going to be the best way to help you move through this one, this ailment at that point.
Okay.
Yes.
All right. Thank you so much, Dr. Paul. Now, if you could leave anything to a woman, a young man watching you there, anything just to keep at the back of our minds, especially as we come to the close of the Breast Cancer Awareness Month, what would it be? Any tip, any hug, any advice, anything whatsoever? So,
I think the most important thing to take away from this is breast cancer is preventable.
Okay.
And we have taken steps in trying to improve both the quality of treatment and the quality of life of those who have been affected by breast cancer. So in our fight against breast cancer, prevention is our first line and our most important step. Yes. If we can prevent it, then we can reduce on the incidence and the mortality and morbidity of breast cancer. Yes.
All right, and you are telling us about ADDY Memorial. Where do we find it? How do we find you, Dr. Paul, in case we have more questions for you in this regard?
So ADDY Memorial Hospital, we are located in Kanyanya, Chebando, Bahai Road, plot 1 and 2. And of the screening modalities I had spoken about, mammograms and the breast ultrasound scans, we are doing them at ADDY Memorial, as well as the biopsy. We are doing them at ADDY Memorial, and I also work at ADDY Memorial Hospital, so I can be found at ADDY Memorial Hospital.
Okay, perfect. Thank you so much to Dr. Paul and to Dr. Colin as well. We hope to have you again. The discussions when it comes to health are quite many, and even as the world, even, how did you call us? We are getting into a developing country. Even as we get into a developing country as Uganda, the concerns on health become so dire. So that is all the time we had for you. We hope you got to learn something, take away something. Please seek out hospitals that are offering free consultation, free screening, free advice, whatever it is. One of the things that I have noted, I know someone, a family friend who had breast cancer. Even when they survived, their mentor was they were affected mentally by it, by all the medication they had to go through and things like that. So you may think that it's only physical, but it could also affect here. Am I right?
Yes, yes.
All right, let me not diagnose you right now, yet we have Dr. Paul in the building. We have to go for a short break. When we return, we'll be wrapping up the rest of Wide Awake with Dickens, so do not go away.